Leaders have warned that the crisis in social care will leave the NHS struggling to cope because so many people are unable to leave hospital. At the weekend, the Royal College of Emergency Medicine said the pressure on A&Es was worse than at the height of the pandemic. The shortage of care workers means firms are having to turn work down, which is leading to long waits for care packages for hospital patients. Our health correspondent Jill Dummigan's been out with one company in Liverpool.
Emma Wilkinson works all over Liverpool, caring for people who struggle to look after themselves.
We're going to see a gentleman called Tony today. So we look after Tony 7 days a week, 4 calls a day. Morning, Tony.
Morning.
Are you okay?
Yeah.
Good, good.
Tony's already had his early morning visit. Now Emma's sorting out his medication and getting him a meal.
So, Tony, do you want a roll or do you want some toast?
A roll, please.
Okay.
It is very helpful. See, I can't cook. See, I'd be lost without them. You know, I wouldn't manage. I like people chatting to me and helping me, you know.
There we go. Okay.
Yeah.
Emma's been working in social care since her teens.
You get a little thanks so much for helping me, we were doing that, or thank you so much for coming to see me today. And it makes you just feel like you've done good, you've done something. You know, you've made a difference in these people's lives.
But the past 2 years have been difficult. First COVID and now rising costs.
Petrol obviously is extortionate now, and that's massively felt within, obviously, you know, filling your car for work. Generally, we've had a lot of people leave. I think that the responsibility of what we do, people don't want it, and they can go and work in a shop or in another industry and get, you know, more money for less responsibility.
The firm Emma works for gets just over £16 an hour from the council for each visit to cover wages, office rent, admin costs and everything else.
National insurance has gone up. Obviously we still pay pensions, there's sick pay and holiday pay and all of that, and the margins are so small now. It is making it very difficult.
Because it's now so difficult to get staff, this company, like most, is having to turn work down.
Our waiting list is 6 to 12 weeks at the moment, which means this is people that are in hospital. They're medically fit to come out, but they can't come out without a care package.
And that's having a real impact on the ability of hospitals, not just in Liverpool but everywhere, to treat new patients. The obvious answer is better funding for social care, but who's going to foot the bill? In 2016, Liverpool City Council proposed a referendum to put up council tax by an extra 6%, with all of that money going towards social care. But when they consulted on it, nearly 60% of people said that they didn't want it. We say we want the social care sector to have more money, but are we actually prepared to pay for it?
Hello, lovely.
Hello.
How are you?
Hi, thank you.
It's for the community to maybe pay a bit more towards social care. We really need to have the funding alongside the NHS because we're all attached to each other, and if one fails, we all fail.
Alice is unable to leave home after a stroke.
It's very good, yeah. Nothing trouble to them. I'm very independent. I do things myself, but I just can't do it now.
People say, oh, they're just a carer, and I hate that expression because these people that are out there are making the most difference to the people that we're looking after. It's massively underestimated how hard social carers work.